Okay, this is the second part of my med video, my oral meds. My hands were still washed from when I was doing all my injections. I'm going to check my MAR for the oral meds. She gets a Lanoxin 0.125 milligrams PO every day. Then she gets acetaminophen elixir 650 milligrams PO every 4 hours as needed for temperature above 101 degrees Fahrenheit. And then she gets Proventil 2 puffs every 4 hours, excuse me, while awake. So double check that. So then I go and I pull my Lanoxin, and it is 0.125 milligrams PO every day. This one is my Digoxin 0.25 milligrams every day. It expires 11/20. So I would do a med math because I have 0.25 and I only need 0.125. Things I would do with this is I would check her apical pulse and make sure it's above 60. If there was a rate rhythm or quality of a pulse changed, then did you get it?
Mm-hmm.
Then I would let the physician know that. Then I will, the Proventil, she gets 2 puffs every 4 hours. Okay, this is Proventil, it expires 2020. And the acetaminophen 350 milligrams per 5 mils expires 1/5/2020. And she is prescribed to get acetaminophen elixir 650 milligrams PO every 4 hours as needed for temp above 101 degrees Fahrenheit. Okay, so we'll do the Lanoxin, just like pill pressure, clean that out to make sure that she's getting just her medicine. Wait for that to dry. Line it up. I would keep the 1/2 in here in case I dropped it or she spit it out or whatever, just so that we had it. Here's the pill pressure. I wouldn't use it on her actually, I'm just going to show how it works. So I clean this out, make sure that everything in here is gone. And drop my pill in there. And I'll just touch that. Then if I needed to, I could give her this in pudding or jello or something that she could easily swallow it. And then the next one is the Tylenol. And I need to go over to the sink and get a med cup because I don't have it. Thank you. Okay, and this is acetaminophen elixir 650 milligrams PO every 4 hours is needed for a temp above 101. This is Tylenol elixir 325 milligrams per 5 mils. It expires 2020. So, and here's my math for that.
Okay, got it.
Okay. So then I would get an eye level. Make sure that she's just getting 10 mils. Okay, let me see that.
Yep.
Okay. And I would gather all this up, my stethoscope, and take this all into her room. My MAR. Hi, Mrs. Jones. I'm here to give you your oral medication. I'm just going to recheck your name badge against my paper. Can you tell me your full name and your date of birth? Okay, so great, that matches. just gonna recheck your temperature. And it is 102. Have you had any Tylenol since you've been here in the hospital?
Just yesterday.
Okay, so that's great. So we'll just sit you up a little bit. And then, because it's been more than 4 hours and she still has a temperature, then I would give her the Tylenol. And let her know that it's, the expiration date on that was January of 2020. And then I have your Digoxin here for you, and it expires 11/20, and you get half a tablet of this. But before I give it to you, you need to listen to your apical pulse, and that is found right here, mid-clavicular line, 5th intercostal space. And I would listen for 1 full minute counting, because you need to make sure that her heart rate is above 60. And for time's sake for the video, I listened for 1 full minute, and her heart rate I've determined is 72, so she can actually have her Digoxin. So then I would give her this half pill. And then now you need your Proventil for your pneumonia, and this is your Proventil, and it expires in 2020 as well. So I would help her with this if she needed it, and put it in this chamber so that she gets the most that she can, the optimum amount. So take a big breath in, push, and I wait 1 full minute, and another breath, push, and then. Okay, I will be back in a little while to check on you. I'll lay you back down. I'll be back to check on you, and we'll check on your temperature and your pain. I'm just going to go and document that we've given you this medication and your heart rate and your temperature. Here's your call light. If you need anything, make sure that you call me, and I'll come back. Like I said, I'll be back in a little while to check on you again. Then I will go back to the nurse's station with all my goodies, and I will document that I gave her the meds, that I checked the pulse, and I will check your temperature.